So the ovulatory cycle, what happens is the follicle in the cortex, or the outer portion of the ovary. So the ovary is a little over a walnut size, and the follicles are within that outer portion of the, and let me get another picture here. Basically, so the ovary here, in the outer cortex area, these follicles develop, and a follicle is this little balloon of cells. So basically, this little balloon of cells, the prenatal follicle starts to develop and grow from some hormones in the brain called FSH, follicle stimulating hormone. And it stimulates these follicles. Think of a follicle as a balloon, and the membranes of the balloon have all the cells to make the female hormones, estrogen, the estradiol, testosterone, and progesterone. So when the pituitary gland stimulates the follicle stimulating hormone, the ovaries, the follicular cells start to develop and grow. And if they receive enough of a constant influence from the pituitary gland, then it continues to develop until it's the right size. Once it's reached the right size, these cells make more and more estrogen. And the higher the estrogen, as it rises rapidly, it sends a signal to the brain, and the brain then releases LH, or luteinizing hormone. Luteinizing hormone then causes your surge. That surge then causes the stalk inside to thin, and the membranes of the follicle cells to thin. As enzymes eat it up, then it allows a hole to develop and fluid in the egg come out. That's actual ovulation. As those cells continue to transform, they now produce, in the last 2 weeks of your cycle, estradiol with progesterone. And so high levels of estradiol, testosterone, and progesterone are now secreted, and that alters the uterine lining. It prepares it for the embryo to attach. It turns them into secretory cells. And now there's a timing of, typically in most women, 1 to 2 days, where there's receptors in that lining where an embryo can attach. If an embryo doesn't attach, then there's signals later on sent to the brain. There's no pregnancy. You can go ahead and stop stimulating it. So then it shrinks. When it shrinks and you have less hormone being produced by that follicle, that corpus luteum, then what happens is there's no more stimulation to the uterine lining, and that lining, the vessels shrink down, and there's no more blood supply then to the outer lining, and it starts to slough off. So it's really the rapid drop in all of those hormones that causes those blood vessels to recoil and to atrophy away. And when they die off, the tissue dies off, and you shed the blood in the tissue.